Hi, I'm Dr. Mark Jagger. I'm the CEO of a company called Spine Advanced, where we build highly innovative medical devices for relieving patients of pain in non-invasive manners. Um, Always considered it a pretty strong mission to get people out of pain. But I went to a little networking slash um, informational, motivational event this weekend. And things like that really cause you to define your goals a little clearer and maybe realize some things about your goals that you didn't realize before. So, in working with patients, I quite committed to getting people out of pain, and I see the results that pain causes. I see the things, people not being able to play with their kids, pick up their kids, um, get out and do the things that they want, sinking into depression, sinking into pain medication, um, dependence, and all the things that causes. So pretty much the whole gamut from minor pain to people who end up getting themselves into life-threatening or fatal situations because of pain. Um, so I want to go back a little bit and talk about my story. Um, so not to garner any sympathy for it, but to make people understand that I understand and I know how they feel when it comes to chronic pain. I know how they feel when it comes to some of the things that issue can create. So when I was 14, now the loss I'm going to describe for myself, it wasn't related to chronic pain, but loss nonetheless. When I was 14, I watched my father get fatally injured at my hockey practice. And it was tough, to say the least. All the things that it caused because of that in my own life, tailspin for many years, and some things that when you get older you realize how they changed, shaped, and made your life more difficult, but how it also shapes the person that you are now. I had a pretty good life after that. Despite that, let's say, things could have gone much worse. I could have used it as a reason to rebel and a reason to make my life bad intentionally. But I used it as a reason to make my life good intentionally, and so I'm lucky that way. I'm lucky I thought that way. Not everybody thinks that way. So now, recently, I have learned of a couple things. I learned of a patient of mine, old patient of mine, that ended up with an opioid addiction and ended up unfortunately passing away due to that opioid addiction. This person had kids, this person had a family, and now their family is going through the exact same thing that I went through when I was 14. And I know how that feels. Accidental, partially caused by own parents' negligence in some case. I know exactly what they're going through and I know how they feel. And I realized that through our device, we're able in some part to possibly prevent these situations from happening. Not all of them, of course, but if in my life's work I could save one family from going through the loss that I went through, and again, I was lucky with the way things turned out. I have a very good family, and my mom remarried, and I couldn't be luckier with the way that turned out. But nonetheless, there's a lot of families who don't get that situation. There's a lot of families who don't get that. You don't get that second chance. And this situation that occurred with the old patient of mine, I can't help but think that if something had been available for this person to get them out of pain earlier, that something like this could have possibly been prevented. And it's not a sure shot, but it could have possibly been prevented. And there's families all over the world right now that find themselves in that situation. We've been contacted a time or two about veterans associations and some of these soldiers that come back from their situations in chronic pain and end up, committing suicide, or end up in a horrible way throughout their life and taking that out on family and all this stuff. And understandably so in some cases, because we don't know what they go through in their heads. But what if something that we do, Spine Advanced, and something that I do as a doctor could, and I'm a chiropractor, I don't deal with the medications. I understand a lot of their effects, but I don't deal with the medications firsthand. But what if I could keep somebody away from those medications that could potentially enhance their lives and prevent their lives from going in a direction that would have a highly detrimental effect on the rest of their family, on themselves, on their kids. Let's just put brass tacks. What if I could save one kid from losing a parent? What if the work that we do could save one kid from losing their parent at a young age, at any age? That would be worth an entire life of work. And so at Spine Advanced, that is our mission. Our mission is to save people from the effects of chronic pain through our devices, through our treatment facility. The worst case possible scenario is somebody ending up going too early because of the effects of their chronic pain. And we've seen it all over the place. We see it with performers, addictions and overdoses. We see it with people who just can't take the pain anymore and end up taking their own lives. And at certain points in my life, and again, not for the sympathy of it, but just to make people understand, and I know what some of these people go through. I've had chronic pain myself. I almost had to go out of my career because of it, until I found the effects of the laser and the spinal decompression, how it helped me. I was having migraines 2 to 3 days a week. I thought I was going to have to quit my job as a chiropractor, and I was about $300,000 in debt at that point in time. So let's just say that, all the things that you could consider that could get you out of that situation, I definitely considered. So I know where these people are at, and I know the point that we have to pull them back from. And there were multiple speakers at this event that described that entire situation, that same situation, how chronic pain brought them to the point where they thought everything was going to be over. And I realize that I'm in the unique position to help some of these people. So that's what we're going to do. That's our mission. It may just, help a patient be able to take their kid to the park, be able to carry them and lift them and push them on the swings. It might be as simple as that, but it might be as serious as somebody who gets into chronic pain, can't find a solution, starts medications, and these medications eventually drive them to their demise. So we can possibly head that off for one person. That's more than a worthwhile goal. So that is our goal. That is our mission at Spine Advanced. And that's why I'm going to continue to do what I do, both with my patients and with the innovation of new devices to try to help people get out of pain. So that's really all I want to say. That's going to be our motivation. Every morning when I get up, I think of, I can possibly save a life. And as a chiropractor, I never really thought of it that way. Some do every day with the adjustments and things like that. But, I think it just really hit me now after 15 years in practice. I may not be directly saving lives, but I'm very powerfully indirectly saving them if I can keep them away from the perils of all the horrible things that can happen with someone in chronic pain. So that's what I'm going to do. And I thank you for listening. If you're in chronic pain, firstly, let me tell you, I know how you feel. And I may know how to get you out of it. One of our devices may be able to get you out of it. And we'll do everything in our power to make sure that we can, get that possible relief to you. This company, we're soon going to be other places than just Canada. We're working very hard to achieve that, and that is the reason. You're the reason. If you're a patient, if you're a person that's in chronic pain, you're the reason that we do this, and you're the reason we're going to continue to do this, and you're the reason that we're going to do this as big as possible and get it as many places as possible. I have people contact me from all over the world that don't have this type of relief, this type of device that could possibly spell relief for them. And we just need to get ourselves rolling enough to be able to get to those different places in the world and give our device, make our device available to these people. So stay tuned. Thank you for watching. It was a little tough for me to open up about myself and about how I feel about our mission and our patients and why we do it. But I think it's time. I think it's time that I did that. And I thank you for watching. Stay tuned.